Hello, this is Dr. Joseph White. I'm one of the ear, nose, and throat specialists here at Greater Knoxville Ear, Nose, and Throat. I'm here to talk to you about chronic tonsillitis. Generally speaking, tonsillitis is an infection or inflammation of the tonsils. Generally, it's caused by group B streptococcus. Normally, if you have simple, straightforward strep throat, you can be treated at your primary care doctor. But if you start to have too many infections, or your infections have special cases, you might be referred to an ear, nose, and throat doctor for a further evaluation for a possible tonsillectomy. The indications for tonsillectomy in children and adults are different. If a child has 7 infections in 1 year, 5 infections every year for 2 years, or 3 infections every year for 3 years, they technically meet indication for tonsillectomy and they should have their tonsils removed just because of the amount of infections that they're having. There's also some other cases where you meet indication as a child for tonsillectomy that we're not going to discuss in this video. The indications for adult are very similar. If you're having a lot of tonsil infections over many years, you meet indications. If you have something called a peritonsil abscess or other signs and symptoms that have been kind of refractory to medical management, you also can meet indication for tonsillectomy. This can include severe bad breath from tonsil stones that can't be managed conservatively, and other medical illnesses. Here at Greater Knoxville Ear, Nose, and Throat, we set patients up for tonsillectomies frequently, and it's one of our most common surgeries. Generally speaking, you go to the OR and the case takes about 15-20 minutes, but the important part is when you go home. We are all very keen on developing and delivering the best pain management. If you have chronic tonsillitis or tonsillar problems, please schedule an appointment with Greater Knoxville Ear, Nose, and Throat today.